In spine surgery, the most important outcomes don't announce themselves early. They don't appear at 6 weeks. They don't appear at 6 months. They appear quietly, years later. Many spine technologies look promising at the beginning. Early pain relief, improved mobility, clean post-op imaging, but early success doesn't tell us how force is redistributed. It doesn't reveal where, and it doesn't show how the body adapts over time. In the spine, biology and mechanics negotiate slowly. Long-term clinical data is difficult. It requires patient follow-up measured in years. It requires consistency, and it requires restraint because it doesn't reward speed or headlines. But without time, we don't truly know whether a solution belongs in the spine. Time reveals stability, it reveals durability, and it reveals whether an implant continues to behave the way it was intended to. The absence of late failures matters, consistency matters, longevity matters. These outcomes don't generate excitement early, but they define trust. In spine surgery, short-term success can mask long-term compromise. When force is redirected instead of absorbed, the effects aren't immediate, they accumulate. That's why innovation in spine rarely fails at launch. It fails quietly, years later. Validation isn't about being first, it's about being reliable. It's about proving that motion can be preserved, not just restored, without creating new problems elsewhere in the spine. At AxioMed, time has guided every decision. We've completed a USIDE lumbar clinical study with more than 10 years of follow-up. There have been no reported device failures, and about 1,000 patients have been treated globally. That data didn't appear overnight. It required patience and a commitment to letting evidence mature. Now, we're entering the next phase: US lumbar commercialization, international cervical expansion, and the advancement of future motion-preserving technologies. This isn't about momentum, it's about readiness, because in spine surgery and in innovation, time is the ultimate validator.